guys, welcome to the Best Practices Show, where we're taking a look at the best business practices from the best dental practices all over the world. And I'm your host, Kirk Barron. Thanks for joining for the number one podcast on best practices, tools, tips for a better practice and a better life. And we come to you every single week with the industry's hottest challenges, problems, and the key opinion leaders. And today you are going to love this because we've never seen this challenge before. And I probably get a call once a day on this, and we're all dealing it within our schools and our practices, everything. We're going to be talking about the future of respiratory health in dentistry. You do not want to miss this. So I encourage you to hit the share button, grab a pen, take some notes. You're going to love this. If you're joining us for the first time, I want to do two things. Number one, I want to congratulate you for finding your way here because we love the learning piece. We just have one mantra here, never stop learning. And so we're going to keep learning. So keep joining us. Number two, I want to just welcome you. Just welcome. And then I want to encourage you to also subscribe wherever you listen to your podcast. Google Play, Stitcher, wherever, and just hit the subscribe button, like I said, because you'll get notified every time we bring you a brand new episode. We also take a ton of notes, and so you'll see the notes once we get those all prepared and get those posted to iTunes. But I want to start by saying, Fred, you and I have been friends for a long time, and every time, you're one of the heroes in dentistry. It's you created 1-800-DENTIST, and then you came out in the scene, and that was a huge, huge hit, huge success. And you've always been a great opinion leader, great friend. And I just want to welcome you today. And you've got your friend, Cherie Penske. Did I get that right? Okay. Yeah. So, Fred, do us a favor and introduce us to not only what you're doing, but Cherie and the topic and why this is so important, what we're going to be talking about today.
Okay, well, we're going to talk about respiratory health and a solution that we have created for it. Now, if you don't know me, I started 1-800-DENTIST back in the 80s. It became the largest dentist referral service in the country. We spent $500 million in television advertising. I wrote a couple of books on marketing, done a ton of lecturing, eventually sold 800-DENTIST a few years ago. And had been looking for something interesting, exciting, and impactful to be involved in. And then Cherie approached me with her company, Armor Respiration, just as the whole COVID crush was occurring. And it's just an amazing company with a phenomenal solution. She's a dental inventor, and she had one other product that I had been around when she was first starting that a few years ago. And so she called on me. So I am a minor partner and chief marketing officer in the company. But Cherie is just a very energetic and inventive person. We're both very passionate about helping dentists to succeed. And now we're very passionate about helping them to breathe. Cherie, talk a little bit more about yourself. I want to give you a little podium time because I could praise you for 40 minutes, or I could let you, we could get on to talking about the technology that we have.
Well, thank you, Fred. Thank you, Captain Kirk, for having me.
My pleasure.
I'm just excited to have Fred, of course, come on board. I always say, whenever I get interviewed, you're my first friend in dentistry. And so Fred and I have been close friends and confidants. And as I've built my first company in dentistry called Armor Dental. So I run a company called Armor Dental. I'm the CEO. And we specialize in both hygiene products and also chairside retraction products. So I am the inventor, as Fred, you've said, of those products. We hold 5 patents. So I'm really proud of the IP that we have and really mostly proud of the just incredible people that I've met along the way that are just my tribe of supporters that lift me up when I need lifting up. Kirk, Captain, I will now add you to that list. And I've been really excited to come on board as a co-founder to Armor Respiration. And we really are proud of this from a personal standpoint where both Fred and I, have a a real nice synergy there where we're entrepreneurs, we work really hard, we're kind of street smart, we are from the East Coast, we, get up every day, work out, work really hard. And there's many people like that watching that are like that. But, this was hard during COVID where it's still hard. We didn't know what's going to happen. So instead of just kind of putting our head in a rabbit hole, we got busy, Kirk, and we really founded this company with our engineer, our regulatory people, our manufacturer, and Fred came on board. And around April timing, we really knew we had some special magic around respiratory health, and we'll get into that a little bit. But that's kind of my background, and I'm just so proud to say during a pandemic, we founded a new company. So I think it's going to be pretty special as we go on this interview today.
Oh, I'm so excited. Out of every adversity comes an opportunity, and you guys found it. And so when Fred was calling me, let me just say this. This is the craziest year any of us have ever seen. I'm still waiting to wake up from this bad dream and tell my family, we were in this pandemic, and they're going to go, you're crazy. And this has flipped this whole industry on its head. We've had a lot of dentists say, I don't even know if I'm coming back. I've had a lot of them get back to work, and now they're like, I'm just sweating like crazy. Some of them are turning down their thermostats. Our kids are going back to school. I got these in every pocket that I have everywhere. I'm washing
hanging from the mirror in the car.
They're everywhere. And I'm like, oh, somebody was wearing this one last time. We're in a world where it's turned upside down. This is a really important conversation in dentistry right now. Wouldn't you agree? On the whole thing. And let's also talk about, I don't know if there's any truth that I'm not a scientist, but when I'm breathing in, I'm getting tired. I'm getting exhausted. I mean, we're breathing in our own exhaust, aren't we?
Yeah, our own CO2. I mean, we'll talk about that in a little bit, but the problem is, we're all now wearing, in dentistry, forced to wear all of this PPE, all of these layers and shields and stuff like that. And it's hot, and it's uncomfortable, and it puts incredible grooves on your face because you got to tighten it so much to get it airtight. And even then, it's fog in your glasses, or fog in your eyewear, or fog in your loupes. And at the end of the day, you've been sucking your own CO2 all day. I mean, there's tons of research about, CO2 impairment, and, N95s were not meant to be worn 8 hours a day. And so we have solved this problem that is created by all of these masks. And it's a lot of people have tried to come up with all sorts of things. It has to be wearable. It has to be comfortable all day, and it has to give you fresh air. And that's what Cherie and her engineer solved with Clara, this air filtration system.
Right. Now, let me throw one more complexity in there, because that might add to the nature of the problem. This thing isn't going away. There's a significant percentage of us that are like, okay, this is going to be over in 2 months. As soon as this vaccine gets here, we'll all be back to normal. But I don't think that's going to be true. I think we're going to have a little bit of a road in front of us before anything gets back to what we would consider normal, right?
I'd agree with that 100%. I think that as we get into the product war, it's very interesting. I think, like all inventors of products, you think you have an idea for something that you're trying to solve for, and kind of the why of what direction you want to go into. And then all of a sudden you start inventing and then producing and manufacturing, and then you see a bigger opportunity. And so COVID is definitely a target for us to help. You think about dentistry and dentists, they're not the number one purchasers of N95s. They're not. I mean, if they can get them, they're lucky, right? So we are purposely making this decision to get to our dentist. We have, we're doing a pilot with a meatpacking plant. We have hospitals that we're doing pilots with. We purposely went together and said, Fred and my husband, who's running the company, we said dentistry is our first target. I mean, obviously, because we're in dentistry, but I'm so excited to say you get it first. You get it first. So I think COVID is a big part of it. But I think, as what you said, Kirk, is really looking at, that respiratory health in general. I think we've been breathing our own air for a long time. So long term, I think we're going to shake it up in a radical approach to breathing. And then lastly, it's really around that sustainability, the availability of PPE. Are we going to run out again? We shouldn't be throwing away masks every day. Why don't we have a better, sustainable, reusable product? And then lastly, really around hazards in dentistry, and we'll get more into this, but we need to protect our dentists better. I go like this because I literally just saw Dr. Myron use Clara for a laser procedure and him not breathing in the toxicity of those laser procedures. So I'm really excited about protection of COVID, but these other areas of where Clara could help the clinician long term.
Wow.
Well, and on top of that, we think this is going to, just like the AIDS epidemic changed dentistry permanently to gloves and masks and coverings over everything. This is going to change how we approach respiratory health in dentistry. And I think it's a good thing because there's an awful lot of people out there working in a dental practice who are exposed to other contaminants. You know, you sit there and grind away at dentures, or you're taking out the amalgam in somebody's teeth, or you're doing a laser procedure. All of these things are creating aerosols, and you're one step away from working in a coal mine with all of that stuff. And so we think this is positively going to go in that direction of saying, let's protect these clinicians permanently. And guess what? This isn't the last epidemic, okay? This happens to be a mildly fatal virus, okay? It's pretty contagious and weirdly contagious, but the mortality rate's pretty low. If it were 3 times this, it would be, if it were 3 or 4%, it would be disastrous. Right. And what's happened is they shut dentistry down. One of our missions is with Armor Restoration is that they never shut down dental practices again, because that's ridiculous. That is not healthy for civilization to close the dental practice in a healthcare crisis.
Right. You think about, there's been 6 global respiratory infections in the last 20 years, which have increased in severity, right? The last one is COVID that tipped us into this pandemic. So, at the end of the day, our customers that have already pre-ordered Clara are saying to us, listen, we're not just using this for COVID and getting us out of COVID. We're using this to sustain. We don't know if we can get our masks. We shouldn't be spending so much money on masks. And lastly, as I said, what Fred, you were really, continuing on is the hazards in dentistry. So sitting here today with you, Kirk, our goal really is to never have our dentists and their teams be caught with their pants down again. Like, we want you to be protected for any pandemic in COVID, but this is not just going to go in your closet after we get through COVID. This is a sustainable, wearable system that's comfortable. It's not a big papper that we'll show you in a minute. It's not uncomfortable. There's no fan or battery. It's not clunky. But this is going to, like you, Fred, said, it's going to be this new concept and behavior that we're hopeful that they'll adopt, that will show them a nice ROI from what they're spending on their current PPE masks.
Yeah, for sure. And Fred, you and I talked about this a little bit. I love our dentists dearly, but some of them are doing a really half-hearted effort to make sure that they're protected and their team members, and we get it. But there's got to be a better thinking, a better solution for the future. And there's no question there's going to be a lot of these efforts. So,
well, and that tips off one more thing that Cherie and I have encountered through Anna Pattison. She was talking to us about how many older hygienists over 60 are not coming back to work because they are in a risk group and they don't feel safe. And Anna believes if they have Clara, they're going to, because they don't want to stop working. They love doing hygiene, but they just don't feel safe. They're either in a practice that is only doing nominal protection, or they just don't feel protect. They're looking for that next level of protection.
Right.
We've actually talked to some groups, and their biggest problem is hygienists not returning. Massive percentage of hygienists. Right. It's creating a crisis.
Yeah, and to add to that, just briefly, it's interesting, Kirk. My mother, as Fred knows, she's passed on, but but she was a dental assistant for, 45 years for these incredible 6 oral surgeons outside of Boston. And she was a single mom for many of those years, married a great guy later in her life. But she, he'd kill me if he's watching this, Mike, hello. But she, if she were told to retire or in her later years, her work was everything. She was an incredible dental assistant that taught me to be a dental assistant during college, believe it or not. And so my point, though, is when Anna Pattison, who is royalty to us in hygiene, when she said she's got hundreds of people that she knows in her age group, 60 to 70, that are worried about returning, and they're staying home and they're retiring early and they're going crazy because some of them are either divorced or single or married and bored. I'm kidding. But, they want to work like my mother. They love to work. And I'm so thankful that she said that to us, Fred, last week, because we really want to help them get back to work and feel comfortable and safe, for sure.
Absolutely. Yeah. Well, dissect this for us. Like, where do we even start? Like, what do you want us to know about this? What do you want us to, because you guys did an extensive research project on all this. And I got to tell you, that's the hardest part for us. I mean, most people are getting their information from YouTube and Facebook now and the news. And so, I mean, every day I go home and, I hear, I'm like, where'd you hear that? Oh, YouTube. I heard it. I'm like, okay. So how did you sort the information? What do you want us, what would you say to a young dentist who's watching this right now on the research side of things? Sure.
I can kick it off, Fred, and you can chime in.
Yes, by all means. Yeah.
Yeah. So it really came from a very heartful place. Our engineer, she's, in her early 60s now. She's been an engineer for many, many years, and industrial engineer. She had has a husband that was suffering from cancer. He's doing fine now, but she was developing, Lisa Fitzgerald was developing an idea around a mask and a wearable unit that would help her husband. So that was back in early March, and she's my engineer. So I said, that's a great idea, Lisa. And to make a long story short, Kirk, we started getting busy with that concept. So with regulatory, we brought in our manufacturer. My husband, who's in life sciences and healthcare and AI as well, has come on board, brought on some researchers as well. One of our first stops was really the University of Maryland. Dr. Stella Hines is a big name in Maryland around respiratory health, and has done numerous studies on elastomeric respirators, which is what Clara is. So she's been on the development of many of these leading products. So we brought her, we confided in her very early on about what we're trying to do around cross ventilation that Fred will get into in a minute. So the research and the science early on was so important about what we're going to be claiming once we get our NIOSH approval, which we'll talk about in a minute. So, we mean business here. I mean, this is not just this, consumer mask. Consumers can wear it, but the engineering to the design of it around the dual inhale and exhale is really a critical part of the design of it to really to be able to cut down on that CO2 buildup. So to answer your question, from the very beginning, we led with research and science around what's currently on the market, what are the issues around the current masks and respirators, and how can we, what's our why? How can we solve those problems? And we led with research first, science, and put together really an advisory board that our dentists, our doctors, hygienists, Michelle Strange, I'll give a quick shout out. She's our infection control expert that's on this. So we've really been leading with, we're the marketing people, but we've been leading a lot with obviously the strong researchers behind this product. Fred?
Well, and basically it solves 3 key issues that people are facing with what they're wearing right now. Comfort, communication, and cross ventilation. These people are wearing masks that are not comfortable at all to start with. Clara's comfortable all day long. When we show you the design of it, because of the silicone gasket that it has, it is soft against the face the whole time. We'll go into more detail, and obviously we're going to show it to you. It's just a long tease, basically, before we actually show it to you. But communication, we have made it clear so that you can be seen. You can see the person's mouth while they're talking. And we've added a little sealed voice port in the front of the mask so that your volume only gets diminished about 15 or 20%, and there's no distortion. So you can be heard as well. So we've solved communication by letting you be seen and heard while you're wearing an airtight mask. Mm-hmm. But the key is cross ventilation. This device has 2 valves on it that control the inhale and exhale flow of air. When you breathe in, it comes through the filtered air comes through, and a little flap controls it. And when you exhale, it goes out the other side. So it's constantly pushing the contaminated air out. You're getting a fresh breath every time. So you can wear it 8 hours and you have 0 contamination from it, because it's always filtered air coming through a HEPA filter. And that's why when you see it, it's got valves, it's got hoses going to little respirator cases that, and Cherie's got one in her hand. We'll start to show you pieces of it.
Yeah, I'm thinking this thing's got to be huge with tanks on the back and everything.
Yeah. It's a moonwalking looking device.
Show the slides, Fred. I think that would be a good idea. Or
I think so. So Kirk, I'm gonna pop it up there.
Hit full screen on your slides, and then whatever.
And then I'm a keynote guy, so whenever I do PowerPoint, it takes longer.
There you go.
So this is a big part that Fred was mentioning is the cross ventilation, Kirk, where you're going from, where the hose, it's a simple 1-inch hose. We wanted this is a professional, product, right? But we also wanted it to be, easy for the patient to see the clinician, especially when you're talking about, a serious case that might be expensive. We wanted them to have, a real nice communication. So that's the clear mask. The voice port is in the center there. That's a sealed voice port, meaning there's no air that comes in there. And the cross ventilation that Fred's referring to is really you're breathing in the air that is protected from our HEPA filter, the respirator that is attached to your body that we'll show you. And that air, you literally feel it coming across your cross ventilation. You feel it coming across your lips basically, and then it cross ventilates out to that exhale valve that you see to her if you're looking at the screen to the right there. So that valve goes away from the patient. So there's 2 concepts for Clara. One is the Clara 1 that you're looking at right now, that's protecting the patient. I'm sorry, forgive me, protecting the clinician. The other concept is a dual hose that has another hose on the exhale port, and that is also to protect the patient, because we kept getting this feedback early on, Kirk, that clinicians really obviously want to protect their team, but what about the patient? So if you're caring about your patient and actually as obviously a marketing tool as well, your team is protected, but we also are talking about our team and our patients as well. So this is a great image there. That's Dr. Robert Stanley, along with his wife, Dr. Bobby Stanley, and their assistant. You'll see that the blue Clara she's wearing it on her arm. So it's almost like a running band. You can wear it there. You can wear it on your belt loop. You can wear it anywhere on your, it's only 5 ounces. As I mentioned earlier, no fan, no battery. So it's like the size of a cell phone. It works beautifully with your loops. That was a really big part of it. So you'll notice that when I show it to you on the screen, in the next slide down, you'll notice that the loops really fit nicely when you are wearing any type of loops there. So we actually have Dr. Yusan Kim wearing it recently, said to us, I love it so much for all the obvious reasons, but she said, it actually keeps my loops in place because she has such a small face. So we really put a lot of thought into not only the engineering of the mask and the respirator, but really what's the donning and doffing look like? How are we going to adopt this product daily that it's used in practice and it's easy to take on and off, clean it, put it back to use the next day. So this is a doctor in Dr. Stanley's office. And then going through the other couple slides, you'll see the rest.
This is a good angle. You can see also. It's meant to hit lower on your nose and under your chin. If you look at the person on the right, you can see that the mask is going under the chin, and then you can see Dr. Hendrickson. You can see his loops. The doctors say when they try this on and they go like, my loops don't fog. This is fantastic. It's meant to land. And this is actually the voice port is not clear in this picture, but normally it would be clear.
like it is here.
This is an earlier prototype version.
Yeah. Sorry. Yeah.
No. Yeah, that's great. Boy, you guys thought of everything, like the fogging, I got guys and gals buying all the lens things to wipe all their lenses all day long and everything.
Yeah.
So
Yeah. It's one of the things that's important. It's good that you brought that up, Kirk, because, if you look at the mask here, and I think it's important, this is if you'd have the dual filtration. So the inhale is filtrated, the air, and the exhale as well. So you'd have the two hoses here. But once the mask is on your face, it's really important. It's only you can hear about 80% of your voice. So if I'm talking like this, you can actually hear me, right? I don't have the hoses on, so it might be a little bit foggy there, but you can hear me fine. Right. Mm-hmm. So my point, though, is the fogging was a big issue for us that we wanted to solve for. So you see the inside here, that is a lot of the leakage that occurs is on the right, about 80% of it, as everyone knows probably, is right around that nose area. So this mask part of Clara is meant to be worn a little bit lower than the other masks that are out there.
Cherie, are you, should we stop sharing? Because you're actually holding the mask, right?
Yeah, he's showing me.
Yeah, I was showing her, and then we can jump back to the. Fred, there's so much technology. I could go to any angle you want. You just tell me. I'm going to be your program director.
And I've got an image of the dual respirator up whenever we want to. Somebody wearing a dual. So
yeah, and that's on screen right now.
Yep, exactly. And you'll see, Kirk, the headgear looks just like typical headgear, but a big part of that is getting that perfect fit and that seal without it having to be too tight, right? So the ratchets in the mask that you see on Dr. Stanley right there are these white things right here. So the clinician, if you need more fitting tightness on the upper nose area, you can push it upwards. If you need the lower chin, because every face is different, you can ratchet it downwards. So it's almost like a customized fit, Kirk, with that mask. Once you get the headgear on, you can ratchet it up. So it's really special. It's a customized breathing experience when you use Clara. The other thing, Fred, we should tell user or viewers is our partnership with Bellis. Bellis is a really, as you know, very special company that does the facial scans, among other things. But we have, extra small, medium, and large masks. But we want to make sure that we've studied a lot of facial dimensions over the last 4 or 5 months and know pretty much what those sizes are that constitute a small, medium, or large. But now customers will be able to go in and take a facial scan, and they will say, okay, Kirk, you're a medium or a small or a large. So it will be an immediate feedback when you place the order. So we want to be just extra careful on sizes, and we think the Bellis app is going to really help us give our customers their exact size that they need. Wouldn't you agree, Fred?
Yeah, I mean, because the goal is a comfortable, airtight fit. That's baseline. That's why, as Cherie said, it's not just the gasket itself and the various sizes, but it is also those two white things that adjust up and down, that control the pressure, either more on your nose or more on your chin. And when you do that, when you dial it in, you make these micro adjustments, you go, oh, that's my fit, right? Mm-hmm. And the other big thing about it that we think is so important in dentistry is that dentistry is a very intimate interaction. And to be able to see the clinician's face is really important, especially if you're presenting a $20,000, $30,000 case. And you've got a full mask on while you do it. I mean, you might as well be waving a 6-gun around at the same time. It's not. It's a lot harder to get case acceptance when you can't be seen. So and just to put people at ease. I mean, people are anxious already in the dental chair. We want them to be relaxed, and also, we could go into, from a marketing standpoint, to be able to say to the patients, look, we are going above and beyond, not just protecting our team, but protecting you. We use a special filtration system on this mask that cleans the air that I exhale and all my team exhales. We all have dual devices that allow us to clean the air that we inhale and that we exhale. It's a great marketing tool at a time when people are avoiding the dentist. You're talking to dentists. They get 30 to 50% of their patients not coming back because they're afraid, or they've been told to be afraid.
Right.
So it's this is an opportunity to get your reluctant patients back and give them the care that they should be getting.
Right.
So,
and I think the respirator, Kirk, you can see me here. This is on the slide that Fred was showing, it was blue, right? So we made this decision that we want to be like Apple, right? So remember the computers that were clear, and so we want to stand for transparency in our respiratory health, and air is clear. So we just really like the feel of this, the look of it, what it stands for. So this is your respirator. It's a very elegant, simple concept, Kirk, and that is, I'll open it up here. You can see this is the HEPA filter. So there's no battery, no fan. You change this once a month. It's like $12. So, $12. You put your name and you put your date right there. So, we're talking, and it comes to you once a month. So you just change it out and then you're good to go once a month. So what this does for you, the hose goes there. You can either wear it on your arm, as you saw in the video. You can wear it on your belt loop. It's only 5 ounces. It feels like a phone. So it really goes anywhere on your body. And we've been testing it. I was recently on the airplane, and I just put it behind on the side to me, or if I'm my purse. It actually is really nice, not only from a dental office, but obviously if you're traveling. We really want to, that whole concept from what are you doing at the work? What are you doing outside the work? So your Clara can go wherever you go. That's really the bigger idea for it. So you're protected in the office and at home, of course. But the respirator is really lightweight. So it's real easy to clean and use it again for the next day.
Yeah. And we've created three different ways that you can wear it comfortably. We've created a harness so that you could wear, send the 2 hoses behind you, and then the 2 respirators slip into pockets on this little harness, this very lightweight harness. You can drop it with longer hoses, just drop it into lab coat pockets, or you can put it on armbands.
And you had mentioned to me, when we talked, you had it for 8 hours. You flew all the way across the country, or
yeah. I mean,
I was miserable for 5 hours wearing 3 different masks. But
yeah, I mean, when I took another flight, Cherie and I were on a flight, and I had to get up really early for it. I fell asleep for 3.5 hours with it on.
I have a photo for you. Yeah, it's so funny.
But I mean, it's that. I talk to every dentist I talk to. They say all I think about now is my mask all day long, and it's like, and I'm on a plane with this thing, and I'll forget for 20 minutes that I even have a mask on. I'm reading, I'm doing something else. I'm not fussing with my face the whole time.
That's a quick photo. That's just me recently flying with Clara, but so you can see a little bit. That's me flying, but I am going to blackmail Fred right now. Hold on, stand by.
Might as well. Why not?
You guys are friends, so I'm going to have to blackmail him. Hold on, you guys are talking, but yes, I think Fred, when we were traveling out to see Dr. Cherie and a few others, he fell asleep. We were on this, 5 or 6 hour flight, and I have to pull it up. When you guys, I'll get it, and I will absolutely blackmail you, because it was so funny. I kind of went up behind him, and this person next to me on the plane's like looked at me. She was trying to protect you, Fred, but she thought I was
just because she thought you were just a weirdo taking pictures of another weirdo.
She did. Oh, here. Oh no. Yeah. Oh, there he is. That's so funny. Hold on.
Yeah. Well, but in a more serious,
there he is. Look at that. You look pretty comfortable there.
You do.
Out cold.
All right, that's another better. All right, that's a better way to go.
The safest guy on the plane, basically.
Yeah.
But
yeah, that's actually a very, very good point, and that is, Kirk, when I we've worn Clara's, for months now, and testing the product and making, certain little changes, like, this is now clear, just simple changes, but also some important changes, like adding that dual, when you're exhaling, having the clinician be able to protect their patients as well. So all these really interesting points, but I think that, shoot, I lost my train of thought. Don't you hate when that happens? What were you just saying? There was an important point.
Oh, it happens to me several times a day.
All right. Well, I'll go to another important point. Is you're talking about how long you can wear it, and that you feel safe wherever you are. I mean, that's right. I just walk around in the airport and I go like, I'm the safest person here. But
yes.
On a more serious note, I don't
remember it, though.
The clinicians that we talk to, they're talking about the CO2 impairment experience. You know, a good friend of mine who's one of our early testers of Clara, she said, you know, I started wearing N95s. She said the first day I went, at the end of the day, I checked my heart rate and it was 150. She said that this can't be right. And she checked it again and it was, and so what's happening is the CO2 imbalance in the body is basically creating a vasovagal response of fight or flight. So the hormones are powering us through the day. So we can keep working, but you know, a good friend of Cherie's, we were talking to him about it, and he said, look, he says, I actually, at the end of the day, I stopped a case. I stopped a restoration right in the middle of it. He said, I am not going to do this well. This is going to be far from my best work. I'm just going to seal it up and have the patient come back. So this is happening everywhere.
It's a great point for many different reasons. And thank you for being raw about it, because we've had these incredible clinicians that are both dentists, hygienists, nurses, doctors that we know, and they've been very emotional about this, right, Kirk? That this is a problem, and we all know it. And I think this has been a problem for a long time around these N95. So we want to help with that. But the reason why I wanted to jump in is because when it was what I remembered when I wore Claire for the first time on the airplane some months ago. It was right around when we were talking to one of Fred's friends that shared this with us, and she's an incredible clinician. And she said, you know, so I sat in the plane for the first time after a while, and I put the mask on, and it was the first time I felt completely relaxed, and I breathed in. Remember I told you this, Fred? I breathed in this deep breath on the plane. I was just sitting back, and it was exactly what I needed. Like I've noticed that when we wear masks, other masks, we kind of hold our breath a bit. We take little breaths in and out, and we don't do that. And so with Clara, you feel completely protected because you're sealed in, but you have this cross ventilation. So you get this great big thing of air that has no fan in it. And so it's this passive air. But I have to say that's the biggest thing that I've noticed that is so different of an experience, Kirk, and other masks, that you're breathing in this deep breath versus little bitsy breaths. Anyway, I wanted to chime in there because I think that's a big problem with our clinicians, that they're not breathing in deeply enough, and they're getting that fight or flight. Like I gotta slow it down here or stop the case. So, I appreciate these clinicians that have been very honest with us, and they have been the early adopters and helped us design this product, frankly. So
right. And dentistry is a physical sport. Before COVID, we were like trying to stay on them about exercise and sleep and nutrition. And now this is an important conversation. Air quality during the day it's a real issue. The other thing too that I can't help coming to mind is, number one, you're talking to scientists here, so it's really good to have the data, but also you're not selling a product, you're selling a very important peace of mind that, you know, because that's really what that's the whole value prop around it, is like the peace of mind for me, my team, my patients, everybody that's in and around me.
I agree.
And this thing is you know, there's a lot of people attempting all sorts of things like the big helmet and PAPR devices and stuff like that with positive airflow and things like that. They invariably become very heavy. And so we set out to say this thing has to be naturally aspirated. This thing should not need a fan. So if you look at it, you can see all of the folds in the HEPA filter. That's an enormous amount of surface area. And the first thing that happens when we get one of these to you, Kirk, you're going to put it on your face and you're going to breathe and you're going to go, oh, okay. It's normal. It's natural. It's just like inhaling. I'm not sucking air through a filter. It's not laborious like wearing a mask is. You just spend all your time trying to pull air in and push it out in an N95 or your 2 level 3s that you've got on. This doesn't have a battery. This doesn't have a fan. As Cherie said, it weighs 5 ounces. An iPhone weighs 9. So, you know, these things are light. And you know, you're not holding them. Your neck isn't supporting them. The hoses allow you to turn your head left to right, but you're getting cool, fresh air with every breath. And if you searched online for CO2 contamination, there's a decade of and add N95 to it. There's a decade of research on that already.
Yeah.
On how many minutes the buildup takes before it becomes not a toxic parts per million, but from dizziness to headaches to memory loss. And it goes all the way into depression.
Yeah.
So this is we are solving something we think is a critical issue, and we will have this. We are just finishing. We've finished prototyping and prototype testing, and we are manufacturing now. We will have it to deliver in the middle of October. It is fortunately, COVID has created different FDA rules, which allows us to sell this as a mask without going through a protracted FDA certification. We're doing the long term, but we have emergency use authorization to sell this device right now, which is when people need it.
Okay.
So,
and I don't want to be premature to ask this question, but obviously the ROI on an investment like this is, and dentists we've gone through this, like how are we going to get through the HIV thing? And so, I mean, can I even afford this if I'm a dentist, if I have a big practice, am I only going to do this? Give me some perspective on that.
Absolutely. Well, go ahead, Fred. I was going to add.
Yeah, the simplest way to look at it is basically this system, the Clara system that I have up, which is Clara 2, which is the dual filtration system, which is what medical clinicians want. If there's somebody in the room that is unprotected, you want the dual system. That's $429. Filters for this is going to be another $240 over the course of the year. You may replace the gasket once. After a year, you may replace the mask. So in the course of a year, you're going to spend between $700 or $800 to have a Clara system per clinician. The average practice is spending between $1,200 and $2,200 on the disposables that Clara eliminates. We had and I'm not, everybody spends more or less, and some people are wearing the N95s for a week and things like that and trying to clean them and stuff, or they're not wearing them at all. But we had a group practice with 100 offices, and they wanted Clara, and they said, geez, we're going to end up buying about $500,000 worth of these. They brought their CFO to analyze what they would save, and the CFO came back and said, conservatively, $1.5 million. Conservatively. So they're up $1 million, bringing in Clara. They're safer, they're comfortable, nobody's impaired, and they haven't developed a mountain of hazardous waste.
And
that's the ROI of Clara. Clara is a negative cost.
Yeah. And adding to that, that was the first year, Kirk. So the respirator we have about a 3-year warranty. So the first year, as Fred said, it's around a $700 buy, $700 to $800, less if it's the Clara 1, between $600 and $700. That's for year one. But after year one, you're not repurchasing this. You're just purchasing the $12 a month filters, right? And then after, as Fred said, after about a year, you'll change your mask. I mean, it's the highest grade, medical grade, polycarbonate, silicone medical grade. So we expect that to definitely last about a year. The gasket you'll change out, it's just rubbery here. So every 6 months or so. But the ROI is really significant with adopting something like this. What we keep hearing over and over again is that this is really special to all of us, that our orders that have been coming in, it's usually not 1 or 2 per office. I love, we just got an order in from Boulder, Dr. Joyal, and he said, I want this for my whole team. He's got 24 staff. And he said, so, even the back of the house, the front of the house, he's doing the back of the house, of course, in his office. But I love the fact that you dentists, you guys rock, that you are ordering Clara for your team. It's not just for you. Like those Pappers often are just for the dentist because they're very expensive. But Clara at a $429 price point or $329 for Clara One, that's pretty affordable for an expense per year, and then less for the second year because you're not replacing the respirator. So I think that I'm really proud that these doctors or dentists are stepping up and they're protecting their entire team, which is really cool.
Well, and again, I think it's going to do two things. It's going to make the staff more comfortable and allow you to attract more team members. And it's going to bring those reluctant patients back if you market it properly. Like I'm always going to think about what's the marketing angle. The marketing angle is twofold. You're going to bring great people to come work for you that are going to be safe and happy about it and talking about it. One of our dentists actually said that she was one of our first prototype wearers, and she said it's a conversation starter with my patient. Because I get to say, they go like, what the heck are you wearing? And she goes, actually, I'm protecting you. This is the only technology out there where I completely protect the air that I exhale. So this dental practice is safer than anywhere else you're going to go. Yeah. And that becomes something you can write about on Yelp. You can put on Facebook that your patients are going to talk about and do testimonial videos on. This has a powerful marketing aspect because safety is a key message nowadays. And we want team members to feel comfortable coming back to work. And again, we don't want to get shut down. If there's another crisis, we don't want them coming the federal or the state government saying, oh no, dentistry has to close. We want to go, no, actually we don't. We actually have such advanced air filtration system that you should come here if you want to be safe, and you should get one of these yourself.
Right. And one thing I'll add to that just briefly is I think it's really been special, not only, like I said, from the dental team members getting access, having their dentist purchase for them, but I'm hearing our customers say, you know what, this is your Clara. We want you to, take this, you're going to be using it here. Take it home with you, because think about that, Kirk. Many of these hygienists and assistants, dentists, they either are around kids or they're around elder care or they're around somebody compromised with, say, COPD or cancer or any type of disease that's a problem, that protection is so important, right? So I'm loving hearing these clinicians saying, this is your personalized breathing system. It's here to be used in the office. You can take it home with you. Of course, not every office will do that, but many are saying we want to connect you into the health, into the home. So I'm really loving hearing that as well, that they know that so much happens outside of the office that they can't control. So why not help them at home as well? So I've been hearing that. And then the other dentists we've heard say, we know that we're going to be, when we wear this, we're going to have our patients say, well, where can I get one of these? So I love that they're thinking about this overall connection and protection for their their dental team, but also their patients, and this kind of viral protection, if that makes sense. It's pretty cool.
For sure. Absolutely.
And we've even heard people say, look, I want this, for my practice, but also my mom is in assisted living. I can't go see her.
Right.
With this, I can go visit her. It's been 4 months since I've seen my mother.
Yeah.
I want this for and then I'm going to buy them for everybody working in the nursing home too. But if you look at everything, one more quick point here, Kirk, because a couple of questions people always ask is, how do you clean it? It's simple, soap and water. This is your mask, right? As Cherie said, this is your personal mask. It's not an instrument that you've used on a patient. You just wash it with soap and water, and you'll have a mesh bag that you can hang it and let it dry, and then use it the next day. Most of the device, like the respirators and the hose, are going to be under a disposable gown, most likely.
Yeah.
And we actually have sleeves that are washable and autoclavable that will fit over the hoses if you want to make them pretty. Yeah. But if you look at everything that we've included, we're not going to nickel and dime people on accessories. When you get Clara, you get 3 ways to wear it. You get 2 short hoses, 2 long hoses, sleeves for them, clips. Everything is included, including 2 extra filters. so that you owe it. And then the way you order filters is you just subscribe to them. We're recommending you just so that every month you're getting new filters. Everybody changes them because they last for a whole month.
Yeah. Now, a couple of questions are coming in. Can I throw you guys a couple of questions?
Yeah,
Our good friend
let's hear the
Deepak.
questions.
Now, this is a live show, so people come on at different times. I just want to make sure we answer. So, Deepak, I always love your question. He asked, the first question he asked was, does the device hinder in any way talking to patients or performing dentistry? That was his first question. And then his second one was, does the gasket have to be fitted? And you mentioned this a little bit earlier, but can you add some, extra clarity to that?
Sure. The gasket does not have to be fitted. When you order your mask size, it will come with a small gasket or a small mask. So it's and it's really forgiving. There's a lower flap to it on the inside of the chin that will, if you order, say you think we'll have the sizing chart as well as the Bellis app that will really help you size yourself if you're a small, medium, or large, or even extra small. But it'll be forgiving. Like I, for example, I'm a small, but I actually can fit into a medium as well because of that gasket. So it's really, when you get it, this gasket helps you out if you think you've made a mistake. But since we have Bellis and we have a sizing chart, you should be fine. The other question I think is really a great question earlier, Doctor, thank you for asking. You can see this is clear, and this voice port is a sealed voice port. So you can hear, it's about 80% you'll hear my voice. Do you hear me now?
Mm-hmm.
You can hear me now. So hello, how are you? I'm good, thank you.
So in other words, you're not going to hear it perfectly, but you're going to hear about 75 to 80% of the voice. And we have been hearing, Fred, as you know, that has been a game changer, not only the clear of the voice, the mask, but actually being able to talk to your patient without saying what, and I think that's been really a big eye opener that we need better communication, especially when you're talking to your patient who might be nervous or talking about a case that is more of a serious case where they're spending more money, whatever. I think it's really important that you have clarity when you're talking, communication, but also when they can see your face. One thing I will add, Kirk, just so you know, when Fred was mentioning, we get this asked a lot with the cleaning. Soap and water is fine. At the end of the day in our protocol, you'll see our IFU that talks about that. But in between patients, Michelle Strange, who's designed the protocol, you can use a cavicide wipe and wipe the outside of that mask in between patients. The inside of the mask, of course, if it's soiled, you'll have to use soap and water, but this is your own, this is your own mask. So, but if you have something on the outside, you can wipe it with a cavicide and then go on to your next patient. And then at the end of the day, that's when you wash it with the soap and water.
Right.
And I'm a big believer in also you could just use a hypochlorous wipe as well.
Absolutely.
Hypochlorous acid wipe. Which won't harm the device at all. But yeah, as Cherie said, it's communication is one of the key things. Comfort, communication, cross ventilation, communication. When you can hear with only about 20% volume loss and see that person's lips and facial expressions, you're able to communicate. We pick up a lot by watching people's mouths. And also there's a whole bunch of hearing impaired people that are looking at your lips to really understand what you're saying. And the N95s or level 3s are not helping those people.
Yeah, I couldn't hear before all this, and now you put a mask, and now I can't hear anything. And also we're just missing the personal side of it. So I do like the fact that you can see through it. Maybe you can sell it to the NFL coaches who had over $1 million in fines this weekend. They just hate wearing masks. I mean, let's call it what it is. We just hate wearing them. And I guess if you're going to wear them, it better be comfortable and it better meet all these needs. Now, Fred, I'm sure you guys are going to have a ton of imitators. What would you say beware of this about? Or,
it's the whole point of this mask is it's made to be durable, wearable all day, and airtight. And people are going to try to knock it off. They're going to try to put cheaper filters. This is all made in the USA. We are using the highest end. There's only 2 manufacturers of this grade of HEPA filter. And we're having it manufactured and pleated right here in the U.S. All of this stuff is made here. This is professional grade. We're not going out to say to consumers, "Oh, this is your thing for the supermarket." It's like, yeah, it would be great. And if you're immune compromised, we absolutely recommend it. But this is for business. This is for healthcare. It's going to pass a fit test. So a lot of states require fit testing, for dentistry, and this is going to pass. Whereas you could spend half the day trying to make an N95 pass on certain people.
And right? the other thing I'll add to that, Fred, is and to Kirk, is that we have seen a lot of imitators, not imitators of Clara, but other masks that have come on the market that are definitely more consumer. They have smaller HEPA filters that are really small on the mask. The breathing quality we know is not there. So I like anything that can help. I think competition is great, and we learn a lot from that. I will say that the thing that we think we have a home run on is the breathing, for sure, in our mask design. So the combination of the wearable unit and the mask, they're both proprietary. There's a product on the market now that attaches. I think it's a great idea, but I've heard that it's tough we're trying to cut down on the mask buying, right? So there's a competitor out there that I think is a good concept, but again, it's much more about purchasing masks and masks and masks. So this is a reusable mask, and that's really what we're trying to sell home, as Fred said: reusable, better communication, better breathing. And obviously the protection is bar none. So I think if we stay our guiding light for those things right there, we should have a home run. And at the end of the day, we want the clinician to, use Clara. We put as much, and I think I said this, but I'll say it again. We put as much engineering thought into the product as much as we put thought into the donning and the doffing, Kirk. Like we don't want, as Fred said, we don't want you to get a box that's, we want to be Apple. We want you to open up that box. You're spending $400 with us or 300 or whatever, that we want you to open up and say, wow, they've thought of everything that so our customers will notice that when they open up, they're going to say, they're going to have clips, they'll have a harness, they'll have the Clara, the box, all that. And it will feel very special. Like we mean business here with your protection and your breathing. And I think that is what I'm hopeful that our customers are already saying about us, which is really exciting.
Yeah. Well, and one more thing is that we're going to have is support. There's going to be videos that show you how to wear it, how to clean it. And there's going to be, you'll always be able to email us. You'll always be able to, if you're trying to figure out what to do with your team, you get us on the phone and we go, okay, somebody in the office is going to be the expert. Let's get her to make sure everybody fits this right. And she's the one that's just going to go and grab their face mask and move it down to the center of their nose and go, there, that's how you wear it, honey. And they go, oh yeah, now it feels right.
Right.
So we're not going away. We are going to serve many industries with this, but dentistry is always going to be our first love, and people between Cherie and me and you and Kirk, we have thousands of friends that we care about in this industry.
And that was the first thing I said to you. You're like, Kirk, I got something. I'm like, okay, listen, we don't do any product on this. Right. This is purely educational practice, but this is such an important issue for the people we serve, is the ability to breathe and truly have a better practice and a better life. And so I'm like, Fred, I trust you enough that the things that you've always brought have always worked, and the other thing that you and I both know, and dentistry's small. This is not an industry where you come in and make a few bucks and run. So I believe in you guys. I have no doubt that what you're saying is going to be true. And at the end of the day, we want our practices. We love this industry so much. It's an incredibly noble industry, and we are committed to make sure it gets back on its feet. Dentists are thriving again, as they are, and they stay thriving, because we're not going through another shutdown no matter what. No. And so I think we got to be prepared on all fronts for anything that can happen. Yeah. I've long since forgot or tried to predict the future. I'm just done predicting the future. I'm just going to embrace the present and see what we're going to do here the next couple of months. But gosh, I am so grateful you guys have been on today. And I know you have a special offer just for, I'm sure people are going to be watching this saying, how do I find out more, all that kind of stuff.
Yeah. So obviously you can find out more on the website about the product. There's a list of FAQs there that they can search if they have more questions. They can always email us at support@breatheclara.com. If they're ordering in quantity, let's say you got 4 or 5 practices, and you say, look, I need I need 50 of this. You 50 of these. You contact us directly.
Yeah, that's a different discount.
You know, we want to make sure if you go to the website, use ACT as the coupon code, and you'll save 10% on this device, because you're really hearing about it here first. And I appreciate what you said, Kirk, because about putting a product out, because I've been in this industry 35 plus years, and it doesn't go 2 weeks without somebody coming to me and saying, I get this great product, this great thing that you could sell for me. And I turn them all down because they're somewhere between not helpful to expensive or garbage. And actually, Cherie has done this twice. The first product she had with Armored Dental, the ScanMate that she used, when she showed me that, I went, hey, that's really good. I know exactly who you need to talk to about this. And so that product was off and running because it was a really useful product. But this was a quantum leap. When she told me about this, I went, okay, I got to stop whatever else I'm doing and put all my energy into this. So I appreciate your time. I appreciate the opportunity to reach out and help dentists to protect themselves, protect their team, make it safe for their patients, and do it in a way that actually is a positive ROI rather than a break even or an expense.
Right. And I'll just add, and that my last part of that, that piggybacks on it, is that, we wanted to give this a discount, it's 10%, but if you're, if you have these practices that are, whether it's a single practice or other bigger practices, a Boulder office asked us personally to come out and spend half a day with them installing Clara for 24 of their dental team members. And absolutely, that's what Fred said is really important. And that is, many things you said are important, Fred. But that last part is that we really want to help the clinicians. We've got a great team we're building literally weekly with team members that can visit offices and talk about our why, like why the heck we're doing this. And that is,
you can say whatever you want here.
Howard Ferran's been on the show.
But around respiratory health, and we want you to understand it. We want to impact your life and impact your patients' lives and your family's lives. I mean, that sounds dramatic, but we really mean this. And so if you're watching this and you want us to come out and you order Clara, I'm heading out to Boulder soon. And so, then we have Fred and we have other people that we want you to just not think you're going to get the box. That will be beautiful. But we want you to adopt it and use it and then reuse it. So it becomes part of your culture. And I think that if we can up our game all together, Kirk, thank you so much, that if you can help us help our game more with respiratory health with our dentist friends, I'm so grateful. And I really enjoyed it. It's my first time on your show. So thank you for having me.
Well, it's so nice to meet you. Like I said, we're always here, just always learning. I'm sure you guys will bring a whole new level of learning after you've had it running up for a couple more months. And we're just going to have you back and see what we know then.
Yes.
So,
when you get yours, you'll have to wear it and show everybody.
There's no question. I'm going to need one. I mean, just in some of these basic things, I just can't stop thinking about our kids and, our profession. I mean, I send my kids all day to school and I'm thinking, oh, they're going to be fine. Well, they don't go, every day of the week, but like, it's tough. It's a whole new environment that we're all going to have to embrace for a while. So I can't thank you guys enough for coming on and sharing some of your wisdom. And as always, just appreciate everything. So stick around while I say goodbye to all of our guests here. But you guys can check this out. You can check it out at the website. And thank you guys for offering this to our viewers at breatheclara.com. The code is ACT. You can check it out there. So all good stuff. So there you have it on the Best Practices show this week. We're always looking at ways that we can make a better practice, a better life, and breathe better. And respiratory health is no joke. It's a serious consideration for the future. So do us a favor. If you enjoyed today, hit the share button, share with your friends. Keep sending us suggestions for shows. I probably got 4 or 5 of them this morning already on things you guys want to see. And if you've been joining us from the beginning of the COVID conference, I'm going to encourage you to join us on Friday, where we are going to do what you've all been asking for, which is we're going to have the reunion. We're starting the first level of our reunion coming back on Friday, and we're going to have updates from everybody from Linda Harvey to the ADA to the accounting piece, the financial side, things that we know now about all of the government assistance and what might be on the future. So you do not want to miss this, and you'll be able to register at actdental.com, and we'll keep bringing you guys things that you want to see. So send us suggestions. So until we see you next week, hope you guys have a great rest of your day and keep watching the Best Practices Show. You guys enjoy the rest of your day.